Welcome back to What's Now. We are continuing our focus on your health. And as the weather gets cooler, you're going to exchange those flip-flops for boots and closed-toed shoes. What do you need to know to make sure that your feet and ankles stay healthy and you want to, of course, avoid falls? We recently spoke with a doctor all about this.
Fall is the season we squeeze back into those closed-toed shoes, become weekend warriors, hike through fall foliage, and train for that elusive marathon. But this takes a beating, especially for our feet and ankles. Dr. Thanh Dinh, a foot and ankle surgeon and president of the American College of Foot and Ankle Surgeons, is joining us live with some tips and resources to help keep us on our feet. Thanks for being here today.
Good morning, Christine. I'm thrilled to be here and talk to your viewers about foot and ankle health.
Well, Dr. Dinh, what types of foot and ankle problems do you see this time of year?
Well, this time of year is rather unique because instead of wearing our comfortable flip-flops and sandals that we've been wearing all summer in the warmer weather, now we're starting to wear more closed-toe shoes. And while these closed-toe shoes, dress shoes, and winter boots serve a purpose to protect our feet, I think we also recognize that they can irritate common deformities such as bunions and hammer toes, as well as bony prominences that we didn't realize we had during those summer months. And so we're seeing a number of patients coming in for foot pain related to getting back into those closed-toe shoes.
Absolutely. So do you have any advice for the youngsters getting started in fall sports? And how about for all of us hoping to prevent serious tumbles this fall?
So we are all so excited to see our kids return to fall sports. And these kids are incredibly enthusiastic about being out there and giving it their all. And part of that is that fall sports involve a fair amount of sports that involve cleats. And these kids are running around in cleats that we know may not serve to protect their feet or support their feet the way they should. In our runners and those training for races, whether it be a 5K or a marathon, they're out there running their hearts out and training for these races. But what happens is that they can develop overuse injuries, and these injuries can be small, such as tendonitis or plantar fasciitis, but they can also be more serious, such as stress fractures and injuries that will sideline them from running and other sports activities.
And is there truth behind women who feel that their feet tend to hurt more in the fall?
There's absolutely truth to that. And a large part of that, as we mentioned earlier, is the change in shoe wear. So instead of wearing these comfortable, soft slippers or sandals, instead, women are wearing more dress shoes, maybe shoes with a heel, maybe more fashionable shoes with a smaller toe box that are really squeezing their feet in a way that they're not meant to be squeezed. And as a result, it's really important for our females as well as males to really listen to your feet. And if a shoe or an activity is causing pain symptoms, it's time to maybe consult with an expert.
And any foot care advice for people with diabetes who have to take extra care of their feet?
I couldn't agree with you more about our patients with diabetes being more mindful about their feet. We recognize that in our patients with diabetes, they're at higher risk for foot complications such as foot ulcers and infections. And as a result, they really should have a foot and ankle surgeon as part of their care team. And part of that is we often monitor their condition, advise them on preventative care, as well as advise them on inspecting their feet daily. So that way they are aware of any developing problems. And when these issues are treated early on, we can actually prevent them from having disastrous effects such as amputations and ending up in the hospital due to an infection.
Are there any effective exercises that we can do to strengthen our feet and ankles?
There are absolutely ways to strengthen and stretch our feet to prevent injuries. One of the most common recommendations that we make is the ankle alphabet. It's very simple, where you consider your big toe as a pen and you air draw the alphabet from A to Z. And as a result, this really works all of the muscle groups as well as doing range of motion to all of the joints in your foot and ankle. Certainly, if you have something more specific, you should consult with a foot and ankle surgeon to get a customized regimen for strengthening and stretching.
And where can we find more information, including how to find a foot and ankle surgeon near us?
Absolutely. If your viewers have any questions about foot and ankle conditions, they should certainly head over to foothealthfacts.org. Again, that's foothealthfacts.org, and they can access trusted content developed by our foot and ankle surgeons, in addition to accessing the physician finder to locate a foot and ankle surgeon close to home.
Perfect. Well, thank you so much, Dr. Din, for joining us today. Really appreciate your time and this great information about how to take extra good care of our feet and ankles during this fall season. Thanks so much.
Thanks for having me.